Good morning, sir.
Good morning.
How are you doing today?
Fine, thank you.
Can I know your name, sir?
Dr. Venkateswarlu. I am an emeritus professor of neurology at Andhra Medical College, Visakhapatnam, AP.
Wow. So, all the way from AP, you've come here just to attend this amazing conference that we have held for making people aware on epilepsy.
Yeah, that's true.
All right. So, I have a couple of questions which are very interesting for people to know and understand. Since epilepsy is such a wide topic to talk about, it's such a disease that almost every person, every now and then, can get it, and it's very normal, it's very okay. But what if a child who's studying in a school gets it? I'm sure there are a lot of people making fun of him or her, whosoever's getting the fits. So, कैसे वो डील करे उस सिचुएशन के साथ जब उसके क्लासमेट्स उसका मजाक बना रहे हैं, उसको मिर्गी आ गई, उसको ऐसे कपकपाहट हो रही थी, अजीब बिहेव कर रहा था, कैसे उसको डील करना चाहिए?
So, this is very one of the important psychological aspects or social aspects which is very important when dealing with children. So, what I think ideally we should do is first, I think we must go to the school and sensitize the teachers. What's most important is sensitize the teachers that this is an illness like any other illness, and that should be not be child should not be treated differently. You must understand the teacher also should take active part in educating the children of the class that this boy has been having an illness which is like any other illness, and then it can be very adequately, very effectively treated, and then he is not there are no restriction on him that he can take part in all the studies and then also games like any other child, and then he can be very effectively treated, and then I think reassure the other teachers and then the class children there is no reason to get frightened, and there is a kind of first aid that should be given to the child in case he has a seizure in the classroom, and then he can continue his work like any other child. I think this is a very important message to be conveyed to all the teachers in the school and also his classmates.
All right, sir. So, a very important thing I would want to ask you here. Like we say, the grass is always greener on the other side. We can always talk about the positive things. But the child who's already suffering from it is now also suffering from a lot of things when it comes to his classmates. So, do you think it can also lead to a psychological issue with him?
Yeah, definitely. See, this kind of isolation by the rest of the children, looking at him differently, excluding him from other group activities will have a lot of impact on the child. And then I think the only way is to encourage him. First of all, basically encourage the child that this in no way will exclude you from those activities which give you all the pleasure, like games, engaging with other students. Of course, this is as part of the child is concerned, but of course we have to educate all the other children also that this boy should be treated, should not be discriminated, should be treated like any other child. I think all his friends, all his co-students should be educated about the nature of the illness, benign nature of the illness. It's not like contagious disease, it is not like any bhotam or any other kind of things involved in the illness, and then probably it had to educate both patient, the parents as well as the teachers and the students, so that the child can comfortably sit in the class and then learn like any other child.
Right, that's very correctly said. But also, sir, like we just talk about, something very important right now. I would also want to ask you to the system, the board system that we have, educational system. आपको नहीं लगता कि जो हम 11th-12th में सिर्फ साइंस लेने पे एपिलेप्सी के बारे में जानते हैं, एपिलेप्सी इतना बड़ा एपिसोड है, किसी छोटे बच्चे से लेके, जैसे दूसरे डॉक्टर ने हमें बताया कि पेट में 7 महीने पे भी बच्चे को एपिलेप्सी हो सकता है, तो आपको नहीं लगता क्या इसकी शुरुआत हमें 11th-12th से बल्कि बहुत पहले शुरू कर देनी चाहिए और हर बच्चे को इसको जानने का हक होना चाहिए?
Yeah, exactly. It's very important that because of the social issues involved in this, that it is necessary that health education, which is a part of the curriculum of all these children in the 11th and 12th class, this particular aspect should be included in the medical education, health education program, so that they know what is the epilepsy, what is the first aid that is to be done in case you happen to see a child, and then also the kind of dispel the myths surrounding the illness. I think it should be a part of the curriculum in the health education program.
राइट सो यू आर सेइंग कि जहाँ पे हम लोग स्पोर्ट्स खेल रहे हैं, फिजिकल एजुकेशन सिखाया जाता है बाकी सारे सब्जेक्ट्स के साथ, वहाँ पे एक मेडिकल फर्स्ट एड भी एक सेशन हमें रखना चाहिए ताकि हर बच्चे को आना चाहिए. अगर इन केस किसी को फिट्स आते हैं तो हर बच्चे को उसके साथ डील करना आना चाहिए.
You are very correct.
Thank you so much for your words. I think that is very meaningful to everybody who's watching us right now. Your words really meant a lot to us. Thank you, sir.
So much. Thank you.